Welcome, welcome, welcome to That's Life. I'm your host, Leah Leach. Thank you so much for tuning into our show today. If you have never been to our show, we are a community based show that talks about diversity and community, and we talk about all things related to our community. If you haven't already, please make sure that you like, follow, and subscribe to all of our channels. You can follow us on Instagram for updates at That's Life 0320. You can follow us on YouTube at That's Life by Leah Leach. And of course, you can follow us on Facebook at That's Life 0320 2020. Now, as any of you all know, we asked everybody and we're asking everyone to subscribe to our channel. And I'm so excited to say we are at 71 subscribers and climbing. So thank you to every single person that has shown me love and that has been a part of this journey since day one. And even some of you all have joined in. Thank you so much for joining into this movement of That's Life. We're just here to support community the best way that we know how. So on today's topic, we're going to be talking about where are we now with COVID-19. And I think it's important to have a show about COVID because it is something that is ever fluid. It's something that it's not going to change anytime soon. I think that we have this perception that because some numbers are holding steady and that we're not seeing as much increase in numbers that COVID is not there, but it is very present and is very real and prevalent. So we are going to have a conversation about COVID-19 today. We're either going to go back into a flashback of when we went to season 1 of episode 1, because our first episode that we ever did was about COVID-19. And at that time, numbers were very low. You're going to see just how low they are because they were extremely low back then. But now we're at numbers that are just almost astronomical. And we're going to be talking from the global sense. So obviously in Georgia, numbers are going to be different. They're going to be different in no matter what state or country you're in. But we're going to talk about global because it's important to talk about it as a whole. Before we get started, as I always do, we shout out to our ticker every single week. It's just Miss Jamel Sanderson. If you're looking for a realtor in the Atlanta area, Jamel is your girl. She is the person that's going to help you make the home buying experience an amazing experience. All her information is on her ticker below, so you can get that. She will make the seamless process for you when it comes to your home buying experience. And shameless plug, if you're interested in advertisement for the ticker, you can do all of that, and all that information will be listed in our ad when we run it in the next few minutes. So when we come back, we're going to kick straight off into our show and we're going to talk about COVID-19. Where are we now? We'll be right back.
Looking to have your business or product advertised? Email us at that'slife0320@gmail.com. You can get affordable packaging as well as doing our ticker every weekend on our show on Saturdays for just $10. Email us at that'slife0320@gmail.com for packaging, pricing, and for further details.
And hey, y'all, shameless plug. You know that I published my first book, Walking on an Unpaved Road. I'm so excited about this book. This is the journey of my breast cancer and how it impacted my life. So if you're interested in purchasing our book, all of our information is on our status, and you can also go directly to Amazon and order the book through them as well too. So you have 2 ways to order our book. Welcome back to our show, That's Life. I'm your host, Leah Leach. Thank you so much for tuning into our show about where are we now, COVID-19. As many of you all know, I started this journey March the 21st of this year. We talked about COVID on our first episode. And at that point, we talked about what COVID-19 was. We talked about the impacts that it had on the body and on a person's health and what it looked like. And we also talked about the fact that COVID-19 was something that we were still trying to learn and development at that point. I think we had only really been in quarantine at that point for about a month because I remember my job letting me go the week prior to because of the fact that COVID was very fluid. If you all don't know, which many of you do know, and you've heard me say it before, I work for the school system. And so in working for the school system, we had to learn how to do creative things to be able to make sure that children were learning, but we were also making sure that children were getting fed. And so we implemented a virtual feeding program, which has been amazing. We have serviced over, I believe, 15,000 kids. So it's been a very great asset to the team, to what we could offer children. But also, we had to learn how to do virtual learning. And I know many parents are having issues with virtual learning when it comes to and relating to their kids. And we're going to talk about that later on in a segment relating to schools and what schools are planning on doing, particularly in the state of Georgia, because in the state of Georgia, they're doing something different than other states. So we're going to talk a little bit about that as well, too. So this information that I'm reading right now is from the CDC, and this is directly from their website. COVID-19 affects different people in different ways. Infected people have had a wide range of symptoms reported, from mild symptoms to severe symptoms. Symptoms may appear 2 to 14 days after exposure to the virus. And we've heard this before. We've heard that people that are coming in from a place that's high level with COVID-19 need to quarantine for 14 days. And if you've heard that, I'm sure countless of times. People with these symptoms have COVID-19, and these are some of the symptoms related to COVID-19: fever and chills, cough, shortness of breath and difficulty breathing, fatigue, muscle and body aches, headaches, new loss of taste or smell, sore throat, nausea, vomiting, and diarrhea. Emergency warning signs of COVID-19 are as following: trouble breathing, persistent pain or pressure on the chest, new confusion, inability to wake or stay awake, and bluish lips or face. And those are just a few symptoms. And I know some of you all would say, man, those sound like symptoms of really influenza and all those type of things. Well, as we talked about in season 1, in episode 1, COVID does have very similar symptoms to SARS and to influenza. So you'll see that a lot of the symptoms related to both repeat themselves. So it's very important that although you might think you might have the flu or even a stomach bug, that you definitely go and make sure that it's not COVID-19. And we're going to talk about that also later on in the show. So now here are the numbers from Johns Hopkins. And I know that many of you all say, well, Lee, you didn't talk about the numbers today. I purposefully did that because we're going to give you a progression of how the numbers have increased over time. I've started this show, like I said, March the 21st. So March the 21st until now, our numbers have increased substantially. And I'm going to let you hear just how much they've changed since the start of the show. Okay, so the first show that we aired, which was March 21st, our confirmed cases was 284,566 confirmed. Our deaths at that time was a little over 11,000, 11,868. From that point to May the 9th, same year, y'all, we went from 284,000 to 3,965,863 confirmed. That's almost like an 11 times jump. That's crazy. Our deaths went from 11,000 to 275,527. Our third show, which was May the 16th, so from the 9th of May to the 16th of May, we went from 3 million to 4,563,458,000. Our confirmed deaths was 308,165. Our fourth show, which is May the 23rd, was 5,244,000. Our confirmed cases was over 330,000. Our fifth show, which was May the 30th, was 5,958,000 confirmed cases. And then for deaths, we had 365,000. Our sixth show, which was June the 6th, 6,772,000 confirmed, and deaths 395,000. Then we started season 2, which was in August of this year. So we're in September, so if you can believe that, in 1 month, these are the numbers in 1 month. So August the 1st, our first show that we did, over 17 million cases. So from June to August, we went from 6 million to 17 million confirmed globally, and 680 deaths. August the 8th, We went from 17 to 19 million confirmed and 720 deaths. August the 15th, 21 million confirmed and 766 deaths. August the 22nd, 22 million and 800,000 deaths. August the 29th, 24 million and 830 deaths. And as of today, 9:15 on Johns Hopkins website, we are confirmed 26,651 and 875 deaths. That's the numbers. And y'all, to take a look at the progression of numbers, like I said, when we first started this thing in March the 21st, we were at 275, and that was a lot then, but that was globally. And to think that from March into this point, we've gotten to 26 million. Those are insane numbers. So we're going to keep continuing to talk about COVID because COVID is one of those things, like I said, it's ever fluid and it's not going anywhere. I think it's very important that we don't live in the clouds. A lot of things have been impacted by COVID, including churches, including businesses, including schools, including the polling and how we vote. It's going to be very important that we just be vigilant when it comes to COVID-19. So when we come back from break, we're going to continue on the topic of COVID-19 because there's a lot of changes that are getting ready to come up and happen in our society, including reopening of schools. So when we come back, we're going to talk about reopening of schools and we're going to talk about all the entities that are approached to that. We'll be right back. You can try all those.
Looking to have your business or product advertised? Email us at thatslife0320@gmail.com. You can get affordable packaging as well as doing our ticker every weekend on our show on Saturdays for just $10. Email us at thatslife0320@gmail.com for packaging, pricing, and for further details.
And as you all know, we are still selling my book, Walking on an Unpaved Road. You can go to Amazon and order directly through them, or you can order directly through me. All the information is posted on our page. Welcome back to That's Life. I'm your host, Leah Leach. Thank you so much for tuning into our show today. Before I start our next segment, thank you to every single person that has supported me in this journey of our show, That's Life. Thank you so much to every person that is subscribed to our channel. We are at 71 subscribers and climbing. I'm so super proud of where this show is headed. We are a community-based show that believes in talking about all things related to community. You can go back from season 1 when we first started our first show on March the 21st, and we talk about just different topics that relate to everything that we're dealing with in our community. Our first show was about COVID-19. The first show we ever did was about COVID-19 and how it impacted us then. And at that point, we didn't really have a real idea of what COVID-19 was. We knew that it was a new virus that was moving fast and it was fueling fast, but we could have never anticipated and expected that COVID-19 would take the turn that it's taken in our society. You could not have told me last year that I was not going to be working in my own school. One of the things that we do in our school system is that we do things virtually in terms of feeding. And it's been very interesting to have to feed in terms of the feeding program because we're not used to children not coming into the cafeteria and not dancing and not doing the things that they would ordinarily do. It has been a different transition for us to serve children through the buses and to serve children curbside at schools. It's just a different walk of life that we've got going on right now. You could have never told me that my children were going to be at home learning virtually because there was such a concern about staffing and about students being in school. It's just a new environment and it's not going anywhere, people. And I think that we need to be very vigilant and very cautious about how we deal with COVID-19. So where are we now with COVID-19? So these are all the new reports that I have read. All this information I got from WSB TV, from their direct website. because it's important to talk about school specifically and how it's impacting school. I know you all hear in the background, I'm playing Chuck Berry, because I think it's important to talk about that because the COVID-19 has influenced school and it's influenced children and how they go back to school. So, some of our school systems have already started the process of allowing children to go back in person. I'll speak for Gwinnett County because I live in Gwinnett County. They have given the option for children to either go to school or to do things virtually. So they're allowing children to or parents to make the decision that's best for their children. But on the Gwinnett County website, they have an anticipated start date for all students, and you heard me correctly, all students, to start back on September the 9th. And those dates are subject to change based on COVID-19. And I just think, again, this is my opinion to it. I know a lot of people would debate with me, but September the 9th is right around the corner. That's next Wednesday, people. So kids are going to be going back to school physically starting next week in Gwinnett County. All kids will be. Cobb County says that some students can return face-to-face learning beginning next month as COVID-19 cases are trending in a positive direction. And they put trending in a positive direction in quotes. The district made the announcement on Thursday that parents can begin choosing the option of next week. And this article was published on September the 3rd, also from WSB TV. Fulton County has decided to skip phase 2 of the reentry plan, which phase 2, if you know anything about the phases, phase 1 is virtual, phase 2 is virtual, half in person. Phase 3 is automatically going in person. So they're going straight from skipping phase 2, which is half and half, to going straight to school. The board is to meet again next week to discuss whether or not the children will be going back to school for Fulton County sometime this year. So talking about my experience with Clayton County school system, I'm thankful we have a wonderful superintendent, Dr. Beasley, who has been very knowledgeable and who is giving us good insight about what he thinks is best for staff as well as students. When we first started the process, we actually had a meeting back in July. And one of the things he talked about was going virtual for at least 9.5 weeks. A lot has changed since then. I know that they are still talking amongst themselves in the board meetings and talking about what is best in terms of bringing children back. But I can assure you that he has the best interest for our children and for staffing needs because he doesn't want people to get sick. COVID is one of those things, like I tell you people, it's fluid. It's never changing. As a matter of fact, it's mutating. And it's so hard to get a handle on this one compared to other viruses in the past because once we get a handle on one thing, it mutates and changes to something else. COVID-19 has definitely shown us different elements of it doesn't matter if you're Black, it doesn't matter if you're white, it doesn't matter if you're female, it doesn't matter if you're skinny, fat, it doesn't matter what you are, it will make you sick and you will be hospitalized because of it. I've had COVID-19 directly impact my circle, my inner circle. I've had family members, I've had friends that have become sick because of COVID-19. And it's a very scary time because you just don't know who can get impacted by this disease. And I think it's very important that we as people are taking care and taking preventative measures to make sure that we're taking care of ourselves and our family. And so my experience with the school system is that we actually had someone come into our school the week before last, and they started putting place cards and place stickers on the floor and on the walls and on the in places where children can see it so that they can know to distance themselves 6 feet apart. I know that a lot of people will argue with me about masks, which is something we're going to talk about later on in the show. But, they're imploring people to wear masks. They're imploring our children to wear masks. It's going to be a very different climate than what we're used to. Something that my wife used to always get on my case about was hugging. I love to hug my babies. I consider your children my children. When they're with me, for the time that they're with me, I consider nurturing them the way that you would nurture them. And so I have a tendency of hugging my babies and telling them how proud I am of them, or if I'm helping them through a process, helping them through a process. Well, that will no longer be the case. I can't hug and I can't show embrace or affection to a child. And it's very difficult. It's just difficult to kind of have that be my normal life now because of everything that's related to COVID-19. It's just a different experience than what we're used to. I even know with some employers that they're not even allowing some people to come in to work, that everything is still has to be virtual from home, even though the numbers are not as erratic as they were when we first started this process. But again, they're trying to keep people safe and they're trying to keep people at home. Again, I know we want to debate about whether children should go to school or not go to school. My opinion to that, we're going to talk about that later on in the show, is that I don't think that children should go to school right now until they actually get a handle on COVID-19, including with the vaccines. But again, everybody's preference is what their preferences are. I have some people who are a big proponent of sending children to school. That's if that's your drink to choose to drink, that's your drink to choose to drink. I just know for Clayton County, they have made it very easy and seamless for us parents to be able to make the decision about whether we want to send our kid back virtually or not. As a matter of fact, I actually got an email from them the day before yesterday stating that if I want my children to continue virtually, I had that as an option. So I'm glad to hear that Clayton County is doing those things to be able to keep us safe. Now, talking about colleges, because colleges is a little bit different. I know that my wife is in college right now currently, and they did offer the ability for her to go in person or to go virtually. And she chose to do it virtually, which I'm very glad about because when it comes to colleges, a lot of colleges don't make it very easy for people to take online courses. I know that they do for some, but for some colleges that they don't. So in colleges, and this information I also got from WSB TV as well, colleges like Georgia Tech have had a spike in COVID cases in the last few weeks. Over 800 students tested positive for the virus since March of this year. 600 of those 800 were students, and that was from the start of the school year. Students at UGA that are going back to class, knowing that that hundreds of new cases had been reported. Officials reported that 821 positive tests have come back, and that was from August 24th to the 30th of August. Out of those 821, 798 of those were students. The Georgia high school football team season kicked off on Wednesday. And I know a lot of people that have kids that are in football. Like I have a very good friend of mine who's a football coach. He has started his season for his middle schoolers to play. Maintenance put in preventative measures such as skipping the bleachers, as well as keeping 6 feet apart for everyone. So obviously, when we start talking about COVID-19, we're going to start talking about things going back to normal. And our normal will never be normal ever again, people. I know that we want to live in the clouds and believe that COVID-19 seems to not be as, like I said, erratic as it was before. But COVID-19 is very fluid. It is very still prevalent. Even though there's 26 million people globally that have tested positive, you still think that a lot of people have not tested. And that's just the way that it is. You just don't know who next to you has COVID-19 or not. It's just a very perilous and scary time that we're living to. So I know it seems like we want to get back to normalcy and that's our norm and that's what we want to do. But we also have to be very vigilant and cautious about how we live to keep this COVID-19 at bay. When we come back, we're going to talk about some preventative measures that you can do. And these were actually some of the same preventative measures that we talked about in our first show. And we're going to just talk about some things that you can do to keep you and your family safe, especially now that things are starting to open back up. So when we come back, we're going to talk about preventative measures and we're going to close our show. Thank you so much for tuning in. We'll be right back. Finally lay your burden down.
Looking to have your business or product advertised? Email us at thatslife0320@gmail.com. You can get affordable packaging as well as doing our ticker every weekend on our show on Saturdays for just $10. Email us at thatslife0320@gmail.com for packaging, pricing, and for further details.
And remember, you can still order my book, Walking on an Unpaved Road. You can get this on Amazon directly, or you can order it through me. All of our information is posted on our status. So you can get all the information related to the book and how to order if you're going to order it directly through me. The cost of the book is $20, and you can get a personalized message and an autograph from me to you.
For that man that doesn't have a place to stay.
Welcome to That's Life. I'm your host, Leah Leach. Thank you so much for tuning in to our show about where we are with COVID-19. I know that when we typically talk about COVID-19 in our other shows, we don't make a big drawn out conversation about it. I just give you the number so you can know where you are. But I think it's very important that we are talking about COVID-19 simply because a lot of the things that were closed are now starting to reopen, including schools. Schools is a big one. It's a very hot topic that we continue to have amongst people. I have some relatives and friends who believe that children should be going back to school right now. And that's no shade to them. I believe if that's what they believe is best for their child, they're going to do what is best for their child. As for me, I feel that virtually right now, until they can get a handle on COVID-19, is probably going to be the safest bet for my two children. I can tell you that my children have thrived in virtual learning, although it's come with hiccups, including Zoom being down from time to time, or having issues with Google Meet, or having issues with maybe something with the teacher and what's going on. They have had an overall good experience when it relates to virtual learning. I'm thankful for the fact that I have two kids that are very independent, that don't really need for me to stand with them to help them to get through the process of virtual learning. They can actually get through it and navigate. And a lot of times they show me and my wife what to do because we're so behind on the times when it comes to the virtual part of it. So they have taught us a lot about how to submit work and what that looks like. Um, I know that there's a lot of parents that are very frustrated with the virtual learning process. And I would say to that, and I hope it doesn't sound coy or very mean when I say this, but our teachers work feverishly hard all the time, and they're never given credit when credit is due. And so I personally right now want to take a moment to shout out to all the teachers, all the parapros, all the custodians, all the food nutrition people, all the people that the principals, the administrative, the staff, everyone that works in the school system. If you work in the school system, shout out to you because you hold it down. You do all that you can to give our babies the best experiences for them. Shout out to the support staff that is there behind the scenes that you'll never know that they're there to do all the things, the secretaries and the attendance clerks, and just everybody that's involved with the process of the school system. You all, as much as I've seen parents complain, I think that they will know and they can recognize that you all offer such goodness to our children, whether in person or not. So shout out to every single one of you that are watching the show that work in the school system. Also, shout out to the police officers, to the EMT, to those that work in the hospital, doctors, surgeons, anesthesiologists, nurses. Shout out to you all because you have nonstop work since the pandemic started. And I think it's important to talk about those people because those people have the hardest job. They see people die. They see people come in and out of ICU all the time. So shout out to every single healthcare provider, every single person that has been there for us since the pandemic started. Also, shout out to every person in the food industry because if it wasn't for them, we wouldn't be getting fed people. So shout out to every single person that, even if you work in a fast food, if you work in a restaurant, shout out to you all. And then my last shout out, is to those that have done great work for the community, for all the community building people that are out there, whether that's that you own your own business and you're giving food away from your food pantry, whether it's a church, whether it's a 501, whether it's a nonprofit or a profit organization. Shout out to every single one of you, to churches, because churches, I've seen a lot of churches do good for the community. Y'all are going to be blessed richly because y'all are doing things that are good for the community. And I think that it's important that we talk about those things because we don't talk about those parts of the pandemic. We're just focusing on all the other frustrations that come with the pandemic. And so thank you to every single person that's an essential worker. And I guess I should put this little shameless plug out there. Shout out to the mechanics, particularly my wife, because the mechanics don't get a lot of love either. They're still out there making sure that their cars that are running and moving smoothly, transportation, all the things that come with transportation, and even the transportation in our own school system. Shout out to you guys because you hold it down for us. So thank you for every single thing that you do. So now we're going to move to our last segment of our show, which is how to deal with the spread of COVID-19. We talked about this in our first show when we talked about how to control the spread of COVID-19. It's just so important that we are doing things and being vigilant when it comes to taking care of our health. So the first thing, which is the most important thing, and all this information, I got it off directly to CDC. So if you're looking for information, the CDC has it. Johns Hopkins also has it. So you can get it from one of two places. The first one is to get tested and know your status. Now, typically when we talk about get tested and know your status, we're talking about, I hate to say it, HIV. I mean, that's just what it is. But now we're talking about COVID-19. I need you, if you are able to go and get tested, go and get tested. I can speak for the state of Georgia. There are lots of places in the state of Georgia where you can go and get tested for COVID-19. There are churches, organizations, the Department of Health is constantly doing free testing. So if you live in the state of Georgia, and I know that there's always issues with appointments, whether you can do it through your insurance, but if you live in the state of Georgia, there is no reason why you should not be getting tested for COVID-19. So please and go and get tested. I can't speak for any other state. I can only speak for the state of Georgia. If you live in the state of Georgia and you don't know your status, you better get to know your status and go get tested. The second one, wash your hands as often as possible. Now I know this sounds like common sense, people, but please wash your hands. That actually controls not only just the spread of COVID-19, it also controls the spread of influenza, the stomach bug, anything that has a virus attached. If you have a virus attached to you, washing your hands will control the spread of anything. I know for me, I work in a kitchen, so I'm always constantly washing my hands. However, there are times where I have to step away from my kitchen and I don't have access to soap and water. This is where sanitizer can come into place. Now, here's the other part about hand sanitizer. Sanitizer is a disinfectant, and we're going to talk a little bit later about what a disinfectant is. But a disinfectant basically just takes off the layer of virus. But you want to make sure that when you're using a hand sanitizer that it has 60% alcohol content or higher. So I'm not against the flavorful, smell good sanitizers. There's lots of one that glitter and all that, but it has to have 70% alcohol. My mother even found, and some research studies show that if you don't have access to hand sanitizer, because I know that there was at one point a scarcity when it came to hand sanitizer, that rubbing alcohol and witch hazel also are very effective because they have higher levels of alcohol content. You want to use something with 70% alcohol or greater because that's what's going to kill any virus that you've got. The next one, avoid touching your eyes, nose, and your mouth with unwashed hands. But that's common sense. That's even without COVID-19. That's even when you have a stomach virus. You never want to take a dirty hand and put it to your mouth. Your mouth is bacteria. Your hands are bacteria. You've combined it. Now you've made yourself sick. So please, please, please make sure that you're washing your hands and avoid the contact of your hands in your face and in your eyes, nose, and mouth. The next one is social distance as much as you can. Now, in my house, it's a little bit harder. And I'll tell you, at any given point, I could have up to 11 people in my house. Yes, y'all, I said 11 people. Jesus. Today, we don't have 11 people in our house. Today, we have like 6 people in our house, which is, cool too. So at any given point, I have a lot of people in the house, but still, you still want to make sure you're washing your hands. You still want to make sure you're sanitizing your hands, and you still want to make sure that you're following best practices to keep you and your family safe. When I'm at work, I make it a point to make sure that everyone is social distanced at work, that nobody's standing at the same table together, nobody's working in the same work area together. If you are, that you're still putting some separation between you and the next person, because it's just important to do so. Next, number 5, the one that has been the biggest debate of all debates, wear a mask. People, please. I know we want to make a mask a political civil right, but wearing a mask actually will prevent you and will lower your chances of getting COVID-19. I have a few friends that would debate with me about that as well too. Well, I still got COVID-19 and I was wearing a mask and I was wearing gloves. I understand that, but still is a preventative measure like anything else. I use this analogy, and I know I'm probably going to get in trouble when I use this analogy, but I'm going to use it anyway. You would wear a condom so that you don't get pregnant. Of course, a condom can break and something can happen with that, and you can still get pregnant, but you still want to not take the chance. You still want to wear one anyway, right? It's the same thing with a mask. You put the mask on because it prevents you from getting sick. It's the same concept. Um, it doesn't matter. I always tell people it doesn't matter if it's a cloth, N95, if it's the surgical. Obviously, the surgical masks are thin, so you have to worry about the contention of things coming inside on the sides. The cloth mask, you have to keep it washed all the time. It's harder because you have to wash it all the time. The N95 is good because it has a breathing component where you can breathe and talk, but again, you have to change your mask. And the other part to that is change your mask. Don't wear the same mask 3 or 4 or 5 times because then it becomes ineffective. The next one, clean and disinfect. And we talked about this in season 1, episode 1. There is a substantial difference between cleaning and disinfecting. Cleaning means with soap and water or with bleach soap and water. Disinfecting means a sanitizing solution. So for example, if I'm doing a countertop, I would wash it with soap and water, wipe it down, and then I could use a Clorox wipe and go back behind. That's the clean is the soap and water. The disinfect is the Clorox wipe. Again, it's ineffective if you're just cleaning and you're sanitizing and you're not cleaning, or you're cleaning and you're not sanitizing. You need them both. They're like kissing cousins. You have to have them both. The last one and the most important one is monitor your health. I can't express this more than I can express this any more than today. One of the reasons why we had a show called A Better You, A Better Me was because a lot of people that have gotten COVID-19 have had underlying health issues. Now, before I say this little shameless plug, a lot of people that got COVID-19 did not have underlying health issues. A lot of people that died from COVID-19 didn't have issues with high blood pressure or didn't have issues with cholesterol or diabetes, but a lot of people did. A lot of people had underlying health problems, and then COVID-19 exacerbated that. So it's just very important that you're taking care of your body. You have one body, one temple. Take care of it the best way that you can. I made it a mission for myself to lose weight because one of the things I noticed was that I was having trouble breathing. And I didn't really know the impact of what that was until COVID-19. I'm thankful to say that I haven't tested positive. I am going to go get tested very soon to just make sure that I am well and that I'm doing well. My family is doing well. But one of the things that I was very compelled by was to lose weight. And as many of you all know, I've lost 41 pounds and counting. Whoop, whoop. I'm so excited about that because it's made me feel good. It makes me feel good physically, emotionally, but it makes me feel good spiritually to know that my health is in order so that if I get sick or something happens, I can rebound from it quicker. That's not to say that nothing couldn't happen, but I'm not proclaiming that and I'm not putting it out there to the atmosphere that it will. But it's important to take care of your health. You only, again, have one body, one temple. I know some people would argue with me, well, I want to eat that cheeseburger. Well, you can. But again, just keep in mind that your body is, it's a sponge to everything. So you want to make sure that you're taking care of yourself the best way that you can, that you're getting proper amount of sleep, that you're not drinking and consuming large amounts of alcohol, and that you're not doing things that can cause your body to have additional problems. Just take care of yourself. And one other key thing that's very important is medication. My wife and I both, we take medication. I take blood pressure medication. My wife takes medication for her asthma as well as rheumatoid arthritis. It's very important that your prescriptions are up to date so that if you have any issues with your health, that those things are good to go to. So just please make sure that you're taking really good care of yourself. I cannot express the need to self-care. One of the things I have learned this year that I believe that 2020 has taught me, outside of the fact that 2020 is a Jumanji game, because I will say it, we are at the next level of Jumanji every single day. The one thing that 2020 has taught me is self-care. You have a responsibility to take care of yourself. As my wife always eloquently tells me, you cannot pour from an empty vessel. If you're empty and you're trying to pour into something, you need to be full to pour into it. So please make sure that you're taking care of yourself spiritually, physically, emotionally, so that you can be the best that you can be, and that you can be the best person you can be. All right. So, as you all know, we always end with a quote and we always end with a Bible verse. And I'm not going to make an exception to this show because it's very important that we do. So, our quote today is from an unknown poet or unknown author. An empty lantern provides no light. Self care is the fuel that allows your light to shine brightly. Remember that. You can't pour into something unless you're full. Our Bible verse, Ephesians 2 and 10. For we are God's handiwork, created in Christ Jesus to do good works, which God prepared us in advance for us to do. Make sure that you're taking care of yourself. Make sure that you're taking care of your family. Be good to yourself. Be good to your family. Until the next time we meet again. See you next week as we talk about something new. See you later. Bye.